Welcome to this video on cardiovascular disease. These are our learning objectives for this topic. The first one is to be able to describe coronary heart disease as an example of a non-communicable disease. And the second is to be able to evaluate the treatment of cardiovascular diseases using drugs, mechanical devices, or transport. As always, all of the necessary timestamps will be in the description below, so feel free to skip to whatever part you need help with. These are our three main definitions for this topic. The first is coronary artery, which are arteries which supply the heart muscle. The second is a stent, which is a tube-like device which is used to keep blood vessels open. The third are statins, which are a type of drug which reduce the levels of bad or LDL cholesterol in the body. There's not really a lot of required knowledge for this topic. However, I would advise having a general knowledge of the overall structure of the heart and its blood supply. So for example, knowing how coronary arteries supply the muscle, so you can understand better how different illnesses can affect the heart. And then also just having, again, a general knowledge of the symptoms of heart diseases. For example, fatigue or weakness is also good to know. A really common example of a cardiovascular condition and a non-communicable disease is coronary heart disease. So in order to understand this illness, we have to understand the function of coronary arteries. So we can see on the diagram on the screen a few of the coronary arteries which supply the heart. So for example, we've got the left coronary artery labelled here. So these arteries essentially supply the blood muscle with all the nutrients and oxygen that it needs to survive and to contract to transport blood around the body. So coronary artery disease occurs when these vessels become blocked with the buildup of fatty material, and this is known as a plaque. So obviously, if we have lots of material building up within our vessels, they are only a sort of finite space, and if we have a buildup of other materials, that blocks the flow of blood, and this means less blood is going to reach the heart. And this is going to reduce its supply of oxygen and other essential nutrients. And if parts of the heart muscle are cut off from the nutrients they need, they can die. And this can lead to a heart attack as the heart muscle is unable to contract properly and pump blood around the body. Devices known as stents are a really useful way to treat the blockage of vessels, for example, in coronary heart disease. So a stent is essentially a metal mesh tube which is inserted into an artery to kind of prop it open so it can have full blood flow. So these are effective in lowering the risk of a heart attack as they prevent parts of the heart muscle from being cut off to blood flow and therefore oxygen and nutrients. It's also a very quick surgery with a quick recovery time. However, there is a chance that blood clots can form in the area near where the stent is placed, so that obviously is an additional danger. In terms of the pharmaceutical options of treating coronary heart disease, statins are also a really popular alternative. So these are essentially a drug which can reduce the levels of LDL cholesterol within the body, and this is one of the major risk factors for the development of plaques which can block the arteries supplying the heart. So this type of drug is usually taken long term as it slows the rate of deposition of fatty material and plaques within the arteries. However, they do have certain side effects such as dizziness, headaches, and nausea, which also have to be weighed up when deciding to prescribe these to someone. Now we're going to move on to a different type of cardiovascular problem and explain how we would treat that. So if we think back to the structure of the heart, we have several valves within different chambers which prevent the backflow of blood. However, these can also become faulty, and this is when they become so stiff that they cannot open or they leak, and so they don't prevent the backflow of blood, which is really essential in the heart so it can work as efficiently as possible. So there are two solutions when we want to replace a heart valve, either a tissue or biological valve or a mechanical valve. And each one of these has different advantages and disadvantages. So a tissue or biological valve is often taken from a pig, for example, and these last about 12 to 15 years and work fairly well. On the other hand, a mechanical valve is obviously artificial, made out of like metal and other materials, and these tend to last a really long time. However, there is an increased risk of blood clot formation if you do have a mechanical valve. Therefore, you have to take medication as long as you have the valve to prevent the formation of blood clots. Type of treatment for cardiovascular disease or illness is artificial hearts and artificial blood. So if we start off with artificial hearts, so this is normally in the case of heart failure, which is obviously going to require a heart transplant eventually. However, this requires a recently deceased donor, and this can take quite a long time to come as the transplant list is very long. So an artificial heart is used to kind of bridge the gap between the illness and then getting a brand new transplant. So the benefit, or the major benefit of an artificial heart is that it's less likely to be rejected by the person who receives it, as it's just made out of metal and plastic, for example, whereas if you had a donor heart, you'd have to match the blood type and the tissue type, etc., to make sure they didn't have a reaction to it. However, as it is made out of metal and plastic, it could wear out and fail, and also there is an increased risk of blood clots, which means you have to take blood thinning medication if you do have an artificial heart. Moving on to artificial blood, this is really only used in cases of extreme blood loss, for example in a major trauma, and it's essentially a salt solution which carries out oxygen and carbon dioxide transport. So if someone's lost a lot of their red blood cells, this allows these kind of key examples of transport to take place while their body can produce new red blood cells. However, this is only a very short-term solution. Eventually, if you've lost a lot of blood, you're going to need a blood transfusion, but obviously the blood type of the donor needs to match the person who's receiving it again. So this is again a method of bridging the gap between trauma or disease or illness to getting a proper transfusion. This is our first worked example question for this topic. So doctors trialled 4 different treatments for reducing the risk of heart disease. Each treatment was trialled on the same number of patients for 5 years. The patients did not have heart disease at the start of the trial. The graph below shows the results. So if we look at the graph in the question, on the x-axis we've got the names of 4 different drugs which were given during the trial, and then on the y-axis we have the number of patients who needed treatment for heart disease during the trial. The first question is how many patients who took aspirin needed treatment for heart disease during the trial. So for this bit we essentially just need to read off the graph that's been provided. So it's talking about aspirin, so we know we're going to be looking at the first bar on the bar chart, which is here, and then reading off the y-axis we can see that it comes up to the second line after 400, so that's going to be 420 patients. The second question is, based only on the evidence in the graph, which would be the best treatment to reduce the risk of developing heart disease? So if we look at the graph again, remember that the y-axis is telling us the number of patients who developed heart disease. So if we're trying to reduce the risk of developing heart disease, we want the treatment that has the fewest number of people who actually ended up developing it. So just looking at the shortest bar, that is going to be statins. Finally, suggest one other factor that a doctor might consider before deciding which treatment to use for a patient. So there's loads of factors that you could mention. Just a few good ones could be the cost of a treatment and also the side effects. For our second word example question, please have a go at it yourself and then I will walk you through it. So this is essentially a comprehension and evaluation question. So people can be treated for cardiovascular diseases with statins or aspirin. Information about these two drugs is given in the table, so make sure you've read all that information. Would you recommend statins or aspirin for the treatment of cardiovascular diseases? In your answer, you should give your recommendation and use information from the table to support your recommendation by making comparisons of the two drugs. So for this sort of question, I'd recommend taking each side, discussing the advantages and the disadvantages, and then making a conclusion based on that evidence. So if we start off by going through statins, we can talk about the pros and cons of those using the information from the text. So in terms of advantages, if we look at the text, we can see that statins were found to reduce the rate of non-fatal heart attacks by about 30%, which is obviously a really good property if we want to use it to treat cardiovascular disease. Secondly, they also have quite a low rate of side effects. If you look, it's only 0.1% and 0.01% compared to aspirin, which has slightly higher rates of side effects. In terms of disadvantages, it could be one that it's only available on prescription, which means it's a lot less available to the general public, and some people who are at risk of cardiovascular disease might not be prescribed this, so it's kind of a barrier to obtaining it. It's also quite expensive, between £150 and £500 per year, which can add up if you're treating quite a lot of people. Moving on to aspirin. So one major advantage of aspirin that immediately sticks out is the fact that it can be bought over the counter. This means people can have very easy access to it and it's very readily available. It's also quite cheap to treat someone with it, as it only costs up to £15 per year, which is obviously a lot more affordable if a patient is going to be buying it themselves. Then thinking about the disadvantages, that is more on the higher rate of side effects at about 0.5%. And then also the fact that it's not suitable for older patients, as shown in this paragraph, as there is an increased risk of damage to the blood vessels in the brain, which could lead to a stroke. And if you think about it, it's more likely that older people are going to be at a higher risk of cardiovascular disease, so that is slightly a problem. However, it does also reduce the risk of non-fatal heart attacks by 31%, as you can see. Another factor to also take into account is the size of these trials. So if you look at the statins trial, that was based on 30,000 patients, whereas the aspirin study is based on 1,000 patients. So obviously the study with the statins is a lot more representative and likely to be more reliable. So we could put that the aspirin, it needs more like kind of larger trials in order for us to recommend using that. But for this question, it's really down to your own opinion. You can choose either one, just make sure you back it up with evidence provided in the text. Thank you for watching this video. By this point, you should be able to explain the origin of coronary heart disease and also explain a few ways in which it is treated. You should also have a basic knowledge of the few most common cardiovascular diseases and conditions, and how we can use drugs, mechanical devices, or different methods of transport in order to treat those. Now go and do some questions focusing on this topic.